So what I'm doing now is pulling the top of the stomach down so we can close that hole up and prevent his stomach from herniating upwards, creating a hiatal hernia, acid reflux, regurgitation, and so many other symptoms like bloating and stomach pain. Hi everyone, Dr. Dave here with Synergy Wellness, Chiropractic and Physical Therapy. Last week we did a video, a long video on start to finish of an exam, from the scans to x-rays to everything, and a treatment. So from start to beginning, a treatment for CostoChondritis and hiatal hernia, which he's dealing with, also some mid-back pain. And again, we did that video last week, but today is his follow-up. So this is his report of findings, his second video, or second visit, really. And I had asked him, how do you feel? How did you feel after your adjustment? It's been about a week or so, maybe a little bit more, since his last visit, even though we just released the video last week. So how do you feel?
The pain came back eventually after a couple of days. For about 4 days I felt okay, and then the nerve pain came back. But I have been following the workouts that the doctor has put out there.
Okay.
I can't say that it's, perfect, but it's been a lot better than, I felt in a year.
Okay, so he, I don't know if you heard that, we have masks on here, and but he felt great for about 4 days, you said?
Yeah.
So did it feel like, sort of like you felt like normal again for 4 days, or?
I felt like the aching, but it wasn't to the extent that I had before coming here.
Okay, and how about the chest pain and the stomach, the acid reflux? How was that?
So the stomach, I haven't had any issues whatsoever. The chest still bothers though.
Okay, so we did a hiatal hernia maneuver on him. He has a hiatal hernia and costochondritis. So that's a double whammy, okay? So the hiatal hernia maneuver helped him quite a bit. He hasn't had any acid reflux or stomach bloating or pain symptoms. That's awesome. Some cases can be really stubborn, but costochondritis tends to be more stubborn in general than hiatal hernias for the most part, but both can be very stubborn. So with him, we're going to continue to do adjusting, and if in 2 weeks the costochondritis hasn't calmed down, just working from his posture and the thoracic spine, we're going to go ahead and take another step forward, and we're going to be a little bit more aggressive, and we're going to use cold laser therapy in the areas where the ribs come and meet the breastbone or the sternum. But again, we're going to wait about 2 weeks and see how he progresses without that. Insurance does not cover cold laser therapy, and a lot of times people can get help with costochondritis just with spinal manipulation, rib manipulation, and exercise and thoracic rehab. I would say it's a 50-50. In severe cases, usually the chiropractic isn't enough. Usually you need that additional cold laser therapy to get through it, and you'll get through it a lot faster with cold laser therapy. So we're going to go ahead and give you your second adjustment, okay?
Okay.
Slide down a little bit. We're going to start off by just loosening up the thoracic region here. We just gave him heat for about 10-15 minutes. So a lot of times people think they can come in for one adjustment, it's going to clear all these problems up. It just doesn't work that way. So in the first video, we went over that he has a couple of disc herniations and bulges in his thoracic spine, in his mid-back. Disc injuries take sometimes up to 3 months, if not more, to heal and repair. So I had asked him, you know, I haven't seen you in over a week, what's going on? And he was a little bit surprised that he had gotten pain relief for 4 days and that it came back. So I explained to him that chiropractic oftentimes works similar to dieting and physical therapy. You would never diet for 1 day, or you would never diet 1 day a week for 10 weeks and think you're going to lose weight, or I hope you wouldn't, right? You wouldn't. But he explained to me that he didn't really realize that it was something you had to do over a period of, you know, 6 to 8 to 10 weeks. It just depends on what your condition is. Like I said, he has disc herniations. So disc herniations take longer than maybe disc bulges would. A disc bulge would take longer than somebody that doesn't have a disc injury at all. So those are all things to take into account. But I like to give the analogy of dieting and exercising, like to lose weight in chiropractic, because you would never diet once a week and then just stop dieting and expect to continue to lose the weight. So what I mean by that is chiropractic is a part of my healthcare regime. I don't go every week, but I do go a couple of times a year, sometimes 6, sometimes 10, it just depends. I got adjusted yesterday, I worked out, I had a heavy workout earlier this week, and then I helped somebody move. So I just needed a little more TLC to my spine. I go see my dentist twice a year for my teeth. My teeth only chew food. That's it. My spine controls everything. Your spine controls everything in your body. Your organs, your muscles, your cells, your tissues, everything. So you really want to take care of your spine as best as possible. And that's where maintenance care comes in. But first, we want to heal and repair all the disc damage, the CostoChondritis as well. Sorry, you're sensitive up there on the front there. And then we can talk about maintenance care, and that's up to you. Not everybody wants to do maintenance care. I have some patients that are in their 70s or 80s and see me once a month, and their quality of life is so much better for it. And other people want to see me once every 3 months, maybe 4 times a year. And everybody's different, just depending on the phase of degeneration that their spine is in. You're a young guy, you've got some injuries to your back. I'm not sure exactly how you injured all those discs in your mid-back, but a little bit of basketball maybe?
A lot of stuff. It could have been a number of things, honestly.
You had a lot of different sports injuries and accidents?
I wouldn't say that. I mean, I played football in high school.
Okay.
It could have been that, and over a period of time.
Okay, we're going to start with this side up. So you're going to lay on your left side. So you played football. Did you play basketball too?
With my friends, I never played.
Okay. I'm surprised you're so tall.
Yeah.
And bend this leg here. Okay. And take a deep breath in. Good, and blow all the way out. And the other side on. So we're just correcting the pelvic misalignment right now, and then we're going to get to your mid-back. And yeah. And how about the chest for the 4 days right after the adjustment? Was there any relief at all?
It was. It just felt like it was numb on the right side.
Okay. Whereas before it was pain?
Yeah.
Good, and on your stomach. All right, now I'm going to have you take a deep breath in, bend your knees, and blow all the way out. Okay, and drop your legs. All right, go ahead, sit up for me and face me. So you'll sit right here. Put your legs right over the edge here. Slide back just a little bit for me. Good. All right, actually slide forward a little more. Cross your arms here. Tuck your chin down. Take a deep breath in. And roll all the way out. Okay. Straighten out a little bit here. So now we're gonna laser your solar plexus just to calm any muscle spasms down in here before I do the hiatal hernia maneuver. This is cold laser. You can relax your arms and just hold that right there. We're gonna hold that there for 60 seconds.
Okay.
And you just keep holding that there. What position did you play football?
Wide receiver.
See that? I wouldn't want to be a cornerback covering you, especially in the end zone.
The height helps.
What's that?
The height helps.
Oh yeah.
Felt that one.
Did you have a headache?
No.
Okay.
I almost never get headache.
Rarely get them. Good.
Yeah.
Some people with a lot of neck pain and tension in their neck get chronic headaches. Very uncomfortable feeling.
Yeah.
Okay, we're gonna go ahead and do the hiatal hernia maneuver. Go ahead and bend your knees for me. Oh, yeah, like that. Good. Okay, you might hear some bubbling or gurgling, like last time.
Okay.
There's a few ways to do this. I usually use a mixture of 2 different techniques. And I heard a little bit of gurgling there, I think, yeah. There we heard some more. So what I'm doing now is pulling the top of the stomach down, back out of the hiatus in the diaphragm, because his stomach, the top portion of the stomach, is herniated up through the diaphragm, through the hiatus, which is a hole in the diaphragm. And today we're going to make sure he leaves with some exercises, some breathing exercises to strengthen his diaphragm so we can close that hole up and prevent his stomach from herniating upwards, creating a hiatal hernia, acid reflux, regurgitation, and so many other symptoms like bloating and stomach pain. That's one technique, and now the other one is to go up from here. A lot of chiropractors do it this way. It has its benefits. Sometimes it can cause a little bit of a reflex spasm. So I start up there and I switch between techniques. Both work, both are effective. We want to get under that rib cage there. Good, and breathe in and out. So we did this once. What was it, over a week ago? About 10 days ago? And he hasn't had any symptoms of acid reflux, stomach pain. So that's awesome. A lot of people end up getting surgery for this, and oftentimes they don't need it. As you can see from his face, it's not comfortable. But neither is a hiatal hernia. Take another couple of breaths in and out. right, you're all set for today. Why don't you stand up? See how that feels. We're going to start seeing you twice a week. We had just kind of spoken about that, about how sometimes people think they can come in once and this problem's going to be cleared up. Unfortunately, it doesn't work that way because oftentimes we've had these problems chronically for years and years, and they do take time sometimes to clear up. I know the hiatal hernia symptoms got better, but it's still there. Okay, you still have that hernia, and we need to fix that. And, I'm going to go ahead and give you some stretches and exercises.
Okay.
Thanks for tuning in, everyone.